Today we are meeting for a very important topic, that is nutrition in pregnancy. So yes, I always say that pregnancy is a very beautiful moment. You are carrying a life which is to be blossomed in few months time. So this is a very crucial phase of your life, and nutrition plays a very important role for this future life to blossom. So whatever you eat, you are that. So this principle is followed in pregnancy as well. So the nutrition is a source of the role of this nutrition is very important, because it is a source of the nourishment for your baby's growth and development. So yes, you should choose a healthy diet and wisely, so that your pregnancy is smooth and the baby is growing nicely. Now, before going to what is nutrition, let me just precisely say how we divide the nutrition into 4 nutrients. So actually 4 ही important nutrients हैं जो pregnancy में लेने होते हैं. Folate, that is a folic acid, iron, calcium, and protein supplements. So I'll just brief about all of them, right? So folic, let's first take a folic acid. So folic acid is a type of B vitamin. This is very important vitamin for baby, because it helps in preventing certain defects in the spinal cord and the brain. तो बहुत सारे neural tube defects होते हैं जो इससे prevent होते हैं. So ideally, periconceptually, if we get a chance, we do start folic acid, and the recommended dose is around 5 mg per day. डाइट में होता है फोलिक एसिड, आपका ग्रीन लीफी वेजिटेबल्स में होता है, फोर्टिफाइड सीरियल्स में होता है, बट समहाउ द amount which is required during the pregnancy or periconceptional period वो उतना sufficient नहीं होता है. So we have to take the supplements. So this is about folic acid. So it's important to prevent certain neural tube defects, and it is very important for the patients who are diabetic or who have a previous history of such defects, right? Then the next comes is the iron. So iron is another very important nutrient, and जो pregnancy में आपकी requirement है iron की, that actually gets doubled. So daily requirement जो हमारी होती है, that is roughly around 27 mg per day in pregnancy. We do get it from green leafy vegetables, chana, meat, and spinach and all, broccoli and all. However, the amount from the diet is not sufficient enough, so we do have to start the supplements in the form of iron tablets. And if suppose your HB is not proper as it should be in the pregnancy, then we have certain injections also to increase it. Then the next nutrient which comes is the calcium. So again, calcium is very important. आपका bones हो गए, teeth हो गए, सब में calcium है. कैल्शियम कहाँ से आएगा? आपका जितने भी डेयरी प्रोडक्ट्स हैं उन सब से कैल्शियम मिल जाता है. जो प्रेगनेंसी में द रिक्वायरमेंट इज अप टू द ट्यून ऑफ 1000 mg. अगेन डाइट से पूरा कंप्लीट नहीं होता है, सो वी डू हैव टू गिव द सप्लीमेंट्स. एंड द लास्ट न्यूट्रिएंट विल बी प्रोटीन्स. सो प्रोटीन इज अ बिल्डर मटेरियल. मतलब अगर हम ये बोलें कि घर बनाना है तो आपको ईट वगैरह से आपका पूरा खांचा बनता है, ठीक है? सो दैट इज द मेन स्ट्रक्चर. सो सेम वे गोज विद द प्रोटीन. प्रोटीन इज अ बेसिक बिल्डिंग ब्लॉक, सो इट हेल्प्स इन अ प्रॉपर ग्रोथ. अगेन हमें प्रोटीन कहाँ से मिलेगा? ऑफ कोर्स फ्रॉम मिल्क, फ्रॉम मीट प्रोडक्ट्स, फ्रॉम योर all these tofu and all. So you get protein from them. And we do give supplements in the form of protein powders, and sometimes if the patient is not tolerating या taste का problem है, then we do give tablets forms. So the nutrients are in these 4 forms, ठीक है? अगर हम इसको medically बोले तो. लेकिन as a food on a table, obviously it won't come as a label that I am iron, I am calcium, right? So what happens is कि हमको food कैसे divide करना है? There is fruits and vegetables, there is a whole grains, then there is a protein, then there is a dairy products, and there is a vegetables. So food को इन 5 चीजों में डिवाइड करना है. Your half of the diet, half of the plate should be filled with fruits and vegetables, then 1/4 with the whole grains, and the rest of it a little bit of fat, and then dairy products. So एक अगर मैं इसको rough precise way में आपको बोलूँ तो it is something like that कि at least 2 to 3 servings of fruits daily. You should include few nuts. वो generally आपको practitioners आपको बताएंगे कि how much of the nuts is safe to take, right? And at least 2 servings of milk, along with 1 serving of maybe chaach or buttermilk. Then whole grains in the form of bread or rice or chapatis, and then the proteins in the form of again dal and all. So your diet should comprise of all this. Now the next comes, what food should you limit in a pregnancy? So ideally, overconsumption of anything is bad, for example, right? So yes, excess of tea, excess of coffee is not right. Ideally, if I speak in a form of a milligram, then only less than 200 milligram is acceptable limit for a coffee intake. So you should not take more because उससे और भी ज़्यादा sleep disturbances and all होते हैं. Plus it induces gastritis, at times certain problems in a baby. Then comes raw fish. Raw fish should not be taken, should be limited. What are then other important foods which are to be avoided? Number 1 is alcohol. Alcohol is not to be taken in a pregnancy because it can produce fetal alcohol syndrome, and generally उसमें क्या होगा कि baby will have the behavioral problems, baby will have the developmental problems. So generally we advise our pregnant ladies that whenever you are planning the pregnancy, try to decrease the amount of drink, and when you come to a level when you are pregnant, yes, you should not be taking alcohol. Again, the same goes for the smoking. Smoking also should not be done during the pregnancy. Then comes about raw egg. That should be avoided. Then unpasteurized food should be avoided because it can predispose to certain infections like listeriosis and toxoplasmosis. Undercooked egg, that should not be taken. Then there are certain fishes in which the mercury level is high. Now that is to be big no, right? Tuna fish and some other varieties, because this mercury is very, very toxic to the nervous system. So it can pose a problem in a kidney, in a brain, or in a nervous system of the child. So these are the foods to be avoided. Excess of sweets should be discontinued, and excess of salt intake again should be discontinued. Specifically, if a lady has developed PIH or GDM, then the things should be taken within a defined normal range, right? Next, I'll talk about certain misconceptions of about nutrition in pregnancy. जैसे कि कई लोग बोलते हैं कि फर्स्ट ट्राइमेस्टर में बहुत मॉर्निंग सिकनेस हो रहा है, हम कुछ भी खाएंगे तो विल जस्ट प्यूक इट आउट, सो वी शुड नॉट बी ईटिंग एनीथिंग. So no, this should not be done. This first trimester, yes, there is a nausea, but however, if you take small frequent meals, then your nausea will be little under control. Not eating will not help. In fact, it can increase the problem. Then there are certain food cravings. ये खाने का मन है, वो खाने का मन है. Please pamper yourself. You should not overindulge in anything. It's just we ask you to not to take papaya and pineapple because they contain certain prostaglandins. These are the chemicals which may lead to mishaps and all. So we ask you to avoid only these few things. Otherwise, you can actually pamper your food cravings. Then comes few people come to the OPD and say कि अब तो मैडम इनको 2 के जने का खाना चाहिए, eating for 2, but she is not eating. So no, this doesn't go like that. The first trimester, there's hardly any weight gain in a baby. It's organ formation time. So the role of a diet doesn't come at all in the first trimester, right? So a lady can eat whatever she wants. It's already first trimester is the most difficult stage because you are feeling so pukish, you are not feeling like eating, you may be feeling smells and all. So ये सारी चीजें चल रही होती हैं. So let her enjoy. Just focus on small frequent meals. If you are not able to eat your chapatis or your meals properly, then maybe you can munch biscuits. Then you can take rice or maybe alternatives like idli or sambar, all those things. However, from second trimester to third trimester, the baby growth starts happening. So in the second trimester, roughly 200 calories per day has to be increased, and in the third trimester, 300 calories of intake should be made extra. So overall, what key points I want to emphasize on is that you should include fruits, vegetables, dairy products, whole grains, and proteins in the form of cereals. These all 5 things should be there on the plate, right? And at least 2 to 3 servings of fruits daily, at least 2 to 3 servings of dairy products daily. And if you are eating small frequent meals, roughly at an interval of 3 hours, so your dietary supplements is actually sufficient enough for your baby to grow nicely. So eat safely and eat frequently, though it may be small in quantity. That will help, and ensure that yes, you have all these things which I've told you in your plate. You can start with nuts as well. So keep eating, stay healthy and stay blessed. Let your pregnancy bloom. Thank you.